Hello, sir. Am I audible?
Yeah,
Panchajanya, the divine conch of Bhagavan Sri Krishna, which was blown during Kurukshetra, indicating the start of the Dharma Yuddha that followed. There are all the efforts were done for the establishment of Dharma. Dharma was kept over personal relations and motives. Keeping the same motive in our organization will work towards establishing the importance and necessary of following Bhagavad Gita culture, accepting our root and making people realize the true essence of Ayurveda, not only as a treatment modality but also a way of life, all this while walking in the path of Dharma. Hence, the motto
श्रेयं भारतीयम् आरोग्यम् आयुर्वेदीयम्.
with the aim of mind, I would like to welcome you all to Pragnavaadhi lecture series conducted for second year students. Now, let me introduce our today's speaker. It is Vaidya M. Uday Shankar. The subject he is dealing is Dravya Guna and the topic is Principles of General Pharmacology. Sir was born on 18
1989.
Dr. M. Dr. M. Uday Shankar is qualified Ayurvedic practitioner with an extensive academic background and notable achievements in the field of Ayurveda. He completed his Bachelor of Ayurvedic Medicine and Surgery in STM Institute of Ayurveda, Hassan, with a gold medal in MD Dravyaguna. He has engaged in guest lectures, national and international conferences, and published articles in reputed journals. Dr. Uday Shankar's involvement in extracurricular activities include winning prizes in cultural competitions and being recognized as the best volunteer during the volunteering efforts. He has attended numerous seminars and medical camps, emphasizing his commitment to the community, health, and education. Currently, Dr. Uday Shankar sir is serving as an associate professor in the Department of Dravya Guna at Ashwini Ayurvedic Medical College, Tumkuru, while also working as a consultant at various Ayurvedic healthcare and centers. We are so lucky to have you on the board, sir. So, if you are ready, let us start today's session.
Yeah, let us start with this
Okay, sir.
session.
I'll hand over the mic to you.
Yeah, when we see the topic general pharmacology itself, it deals with basically you should know what do you mean by the word pharmacology, what is a drug. You have to differentiate pharmacokinetics and dynamics. This much you should know about. And the fourth point is factors influence pharmacokinetics and dynamics. So all these are known to you all. Pharmacon, which means active principles, are the drugs as such. Logos is study. That means the science which deals with the study of the drug. When you can call a substance as a drug, previously it is from the French, that is drogu, that which is nothing but dry herb. Even our Ayurveda starts with a dry herb, churna kalpanas and all. If you see Swarasa kalpana, wet drug and all, we will start with. Even the present science, modern science also starts with the same. They also started with their life with the dry herbs only. And they there you should know about the drug receptors and all. A drug can be used in various forms, especially for the purpose of diagnosis. You can use it for the purpose of prevention of a disease or treating a disease, curing something. Here, treating and curing are different. You should understand. Treatment is timely giving relief, whereas cure is completely coming out from the disease or alter a physiological function of the disease, either by increasing secretion or reducing secretion, as well as generalized effect, which is also called as global effect, which you can see with a drug. These are the different motors where we can use the drug. As the topic is too vast and time allotted is 1 hour, I will just try to make it fast. When you see the source of drug, you can get it in various forms, various sources. That may be a natural source or a synthetic source. Synthetic, if you see, xeno, synthetic generally we see a hormones synthetic hormones which is created, or genobiotics which is being used. You can get a natural source example from the plants which you got, digitalis which gives digoxin, even curcumin from our drug haridra. Then animal source, if you see, commonly we use insulin from pork. Mineral sources, the majority of our Shastra depends on the mineral sources. We use iron, iodine, potassium in the modern part, whereas in Ayurveda we see all the rasa aushadis. Then microorganisms like penicillin, which is being developed from the penicillium for the first time. Then synthetic compounds you have seen, whereas you can see semi-synthetic compounds too. Then we should know about the pharmaco. Basically, when we deal with pharmacology, general pharmacology, it is the content which deals with the drug and the aspects which are related with the drug. Actually, we should know that what does a pharmacology deal with. It is the dealing with the drug as well as the accepts related to the drug, which we see in our Dravya also. We deal with Dravya along with its Panchapadartha. Similarly, here also we deal with the drug and along with the components which are involved in it. When we see uh, in general pharmacology, with the drug, when you see, you should know about pharmacokinetics as well as pharmacodynamics. These are the two aspects of a drug which a person should know. Whereas the factors which influence these two also are very important. Can anyone say what are the different factors which can influence these two? If you see, the factors like route of drug administration, form of drug administration, and duration of administration, dose of drug administration, all these come under form of factors influencing the mechanism of drug action. Okay, then we'll deal with pharmacokinetics first. Kinetics, what comes means movement. Means here we are dealing with the movement of the drug from the time it enters into the body till it exits the body. It is the movement of the drug. Here you should know refers to the, so movement means how the body acts to the drug, on the drug, how body reacts with onto the drug is what we see. So here we have to see the quantitative study of the drug, where the movement of the drug is understood in, through, and out. Means entry into the body, through the body or cells, and out of the body. It depends mainly on four factors, that is absorption, distribution, metabolism, and elimination. You can take them as four phases in pharmacokinetics, or four stages of understanding the drug action under pharmacokinetics. You can take in these two forms. Again, all these are interfered with respect to the mode of drug administration. So you can see when a drug is administered, it is being entering into the body, then observed, distributed, metabolized, and then excreted out. All these four factors we should know. It depends on the route of drug administration. This is a best example which can be given, like inhalers, which will directly enter into the system, injections directly enter into the system, whereas oral tablets take its own time to get into action. 1 minute. Yeah. Absorption, if you see, 1 minute. Sorry for the inconvenience. Yeah. When you see absorption, you should know how much time it will take to enter into the systemic circulation, or how much, what is the process which is taken to enter into the systemic circulation is understood by absorption. Under absorption, it varies with different routes of administration. So initially itself I said General pharmacology not only deals with pharmacokinetics and dynamics, it also deals with different routes of drug administration or form of drug administration. Especially absorption depends directly on different routes of drug administration as well as form of drug administration. Then along with that, you should know bioavailability in the part of absorption, which is a fraction of the drug which is available in the systemic circulation. This is very important point which you should know under absorption bioavailability of a drug. It is nothing but how much fraction of a drug is available in the systemic circulation without any change in its form. Without change in its form. Again, absorption depends on biological membrane. Absorption depends on biological membrane, drug transportation, which will be like when you see with respect to the drug transportation, it will be passive or protein mediated or carrier protein mediated. Once you say it is passive, you no need of energy in this. It is not having like saturation gradient is not dependent on it, no carrier protein is required, or no inhibitor receptors are required in passive diffusion. Then when you see carrier protein, means there is a protein which is linked or a carrier which is there to facilitate the movement. When you see this facilitation, again it is of two types: active transport as well as facilitated. Active, again you get two types, it will come primary and secondary. What do you mean by, like I already told, passive diffusion is one where it depends on the size of the molecule, polarity, degree of ionization, where if there is concentration gradient which is there, it will move from one environment to other environment. And again, passive transport is directly proportional with the pH of the media or the cellular fluids, body fluids. Then carrier protein, always it is the movement. There is a carrier protein which is involved in it, where it will help in transport of the drug from one area to the other area. Commonly, when we say examples as glucose and amino acid transports, gases transports, ion transports, which have been involved in active transport. Then, under active transport, ATP energy is synthesized. That you have to remember always. Under active transport, ATP energy is involved. Here it is of primary and secondary type. Two types are there. Primary again involves ATP directly, and you can take is sodium potassium pump, where sodium is linked with the sorry, ATP get attached with the carrier protein, then sodium enters into the system. Here you can see this ATP goes and phosphate breaks out, then energy is synthesis, which will help in movement of sodium from one membrane to the other, like intracellular to extracellular fluid. Again, once it breaks up, potassium comes down, comes in. This is how you can expect a active transport, the two primary transport. Then secondary transport is one more mechanism which happens where at a time two different ions travel from one media to the other media. This may happen in the unidirectional or opposite direction. It can happen from unidirectional to opposite direction. You can see with the sodium and glucose molecules which are traveling together, sodium and potassium, sorry, sodium ions, potassium ions, here calcium, which will be going together along with Cl minus ions also. So this will happen in a single direction, unidirectional, which is called as symport. If they go opposite direction, it is called as antipode. This is one more important point which you have to see with secondary active transport, where carrier protein is involved, but here the ions will be transferred in a single direction. If it is transferred in the single direction, then you call it as symport. If they are transported in opposite direction, you're calling it as antipode. One more concept comes in under absorption is endocytosis, where it happens with microbes commonly, like phagocytosis, which happens with the same form. A cell membrane engulfs the solid particles and takes into the tissue. This generally we don't deal in common with respect to absorption. Then coming with the next point is distribution. Once it is observed, then it is followed by distribution, where it is supplied to various with the help of various bodily fluids. It is carried to various parts of the body. Here, plasma, interstitial fluid, transcellular fluids, as well as intercellular fluids are involved in this mechanism of distribution. Here we should know volume of distribution. It is like nothing but volume of distribution, VD, you should know, which is said as a total amount of drug absorbed by plasma concentration which is present in it. You have to remember this because it is direct. Here one more place we'll come across with the volume of excretion or elimination. There also this is there. Again, distribution depends on the particle which are means the compound which you are giving, its lipid and water solubility, and k plus sorry ka plus value, as well as degree of plasma protein binding, as well as bodily tissues affinity towards the compound. Then it depends on the personality, that is fat or lean personalities, and various diseases also. And this distribution again affected by blood brain barrier, placental barrier, plasma protein binding, tissue storage. Then comes the metabolism. Once you see with the metabolism, you should always know what are the different steps involved in metabolism. Metabolism is nothing but a chemical alteration in a compound which you are giving from a toxic stage to less toxic form. Very simple it is to be understood. A compound you have given, it's a chemical form. If the body feels it is toxic, it converts it into a less toxic form. This conversion process we are calling it as metabolism, and these compounds are made easily for water solubility. They make it easy for the process of water, like for as water soluble compound it is converted. Nothing but this whole process of conversion we are calling it as metabolism. Commonly metabolism happens in liver. The major site where metabolism happens is liver. Along with the liver, other parts also you can come across with the metabolism, like lungs, kidney, plasma, and blood. You can come across with two different phases of metabolism: first phase and second phase of metabolism. First phase of metabolism starts from the site of absorption till the systemic circulation is attained. This phase commonly happens nothing. In this phase, what does our liver does the major function in phase one metabolism? What happens? Our liver either oxidizes the compound which you give or reduces the compound which is being taken in. Means oxidizing means just adds up oxygen to the compound or reduces oxygen to the compound which is given. Once it removes oxygen, obviously it will add up hydrogen to it. Then it also happens like hydrolysis, that by adding water, cyclization, benzene group is added to it, and benzene rings, especially benzene rings are added. Then decyclization, benzene rings are removed. These are the five major steps which are involved in metabolism, first phase metabolism, which happens in liver. Majority of this compound happens in the liver. One is adds oxygen, we call it as oxidization. Removes oxygen, we call as reduction. When oxygen is removed, directly hydrogen is added to it. Hydrolyzation, hydro means water. hydrolyzation where water compound is added. Then cyclization. Cyclization means cycle. A chain of compound is added. A chain of compound which is nothing but benzene compound is added. Decyclization, benzene compound is removed. This is what we see in first phase metabolism. Then second phase metabolism, various conjugation happens. Conjugation with a compound happens to the our drug which is being administered. One, if glucose, you can see that uridine diphosphoglucosaminic acid, if it is added, then it is called as glucuronidation. Sorry, glucuronide, glucuronide conjugation. Then if sulfate is added, sulfate conjugation is, it is called a sulfate conjugation, or salts, we also call it salts compound is added. Then if a GST compound is added, then it is called as glutathione conjugation. Examples are given here itself. Like for GST compound, we take as paracetamol. We all know major process happens, metabolism happens in liver only. Then amino acids conjugation may happens with few components. Acetylation where acetyl compounds are added, then methylization where methyl compounds are added to it. Here is a brief table from it. Then at the end, once the drug entered, absorbed, distributed, then metabolized. After that, its main compound is to get excreted after it does its function. So the process of removal of the drug after metabolism we are taking as elimination. It can happen with kidney, lungs, biles, intestinal waste, as well as skin, saliva, and milk. Any part which can secrete can excrete a compound. Here are majority of the drug which is seen is from the kidney, alcohols and anesthetics from the lungs, intestines, few tetracycline and all, then saliva and salts, potassium iodide and all, then milk, lipid soluble drugs are removed from the milk. Here comes clearance volume or threshold of clearance. Here nothing but how much amount of drug is removed in a unit time. Rate of removal is noted. Nothing but there we have seen rate of absorption by plasma concentration is volume distributed. Here we will take as volume cleared. Clearance, nothing but clearance, which is rate of elimination by plasma concentration. It is nothing but the rate of elimination by plasma concentration. Then you also should know about plasma half-life. That is also called as T half. Here, how much time a drug is a drug takes to get reduced from the plasma concentration to half of its original volume. So the action is reduced. T half is very important when you administer any drug, so that you decide by how much duration you can give the next dose of the drug. That is about pharmacokinetics, where we dealt regarding the movement of the drug from the time of given orally till it is excreted orally or dermally or anyway you have given it until its excretion is dealt under pharmacokinetics. Pharmacokinetics specially involves four steps. They are absorption, distribution, metabolism, and excretion. Absorption is influenced by the route of administration and mode of administration and dose of administration. Then distribution, again, form of administration plays a major role in distribution, where we have dealt regarding passive transport as well as active transport, where a passive transport as well as active transport, which is a part in carrier protein mediated transportation. Again, facilitated transport. Again, active is two types you have read, primary and secondary. Primary, it will be ATP energy is used, where one direction or opposite direction a compound goes. Here in secondary, there is compound traveling between two different directions, or two compounds goes in a same time. Primary one compound goes in same direction. After one comes, the second may go out. Whereas in secondary, both compounds travel at a same time. Then comes about distribution, where it depends on plasma, interstitial fluids, transcellular fluids, and as well as intercellular fluid concentration, pH, and other factors. Where we have seen regarding volume of distribution, which is nothing but absorption, total drug absorbed by plasma concentration. Again, which is influenced by blood-brain barrier, placental barrier, plasma protein, tissue storage, and all. Then comes metabolism, which is of two phases, phase one and phase two. Majority of the metabolism happens in liver. So we can see that many of the drugs which is administered are said to be hepatotoxic because of this only. The once the drug enter portal vein, default that is been metabolized enters into first phase metabolism, where the drug is being converted from a less toxic form, more toxic to less toxic form, by adding. In phase one, what happens, there may be adding of oxygen or reduction of oxygen, there may be adding of water compound or benzene compound, or removal of benzene compound. Then phase two, what happens, conjugation of sulfates, glucotamate, amino acids, es- acetyl, sorry, acetyl compounds or methyl compounds may happen for their easy or non-toxic effect or reduced toxic effect. Then comes the elimination. Majority, it is from the bodily fluids you get it eliminated. Kidney, lungs, bile secretion, intestines, skin, as well as saliva and milk are those which will eliminate the components. You should know clearance as well as plasma half-life in this particular part of elimination. Clearance is again rate of elimination by plasma concentration. Half-life gives you idea that how much time a drug took to become half of its concentration or reduce its plasma concentration. Again, dynamic, you word itself says it is next part of the context of general pharmacology is pharmacodynamics. Dynamics, whenever we heard of it, we always come across with energy or power, which is been created. Here, power is created by the drug. Means drug is doing something to the body to do its function, to do its effect, to show its effect. So it can cause a stimulation, depression. Under dynamics, you should know what and all a drug can cause. It can stimulate, depress, irritate, or replace or cause cytotoxic action. Stimulation, adrenaline, a common drug which is being given to increase or stimulate a cardiac functionality. Then depression, depress a specific activity of a drug. Barbiturates, which is being given as seen as depressant. Then irritant commonly causes irritation or necrosis of a tissue or less specified cells or epithelial cells. This is what we commonly use a counter irritant in painkillers, ointments, or liniments, or creams. Whenever you apply it, you feel something tingling sensation or reduced pain sensation because they act as a irritant. Then replacement. When you are lacking with a natural compound, you are been replacing it with a artificial compound or available compound. Example, insulin, which has been replaced externally in case from the external animal source or a plant source, especially insulin from the animal source, especially from the pig. We take insulin is given in diabetes, levodopa in Parkinsonism, which we commonly give is Zendopa, this Kapikachu, we give right. That is also having a precursor of levodopa. Then cytotoxic activity. You are targeting a specific cell and you are destroying it. Causes cytotoxic activity, where chloroquine then as is one of the best example. Then if you see Mechanism of drug action, it may depend on a physical or chemical component. In dynamics, how this drug can act is by its physical property or a chemical property. Example, if you see isabgol, which will increase the bulkiness of the bowel, and then it will help in free movement of the bowel, acting as a laxative. Then these functional proteins targets of the drug action. There are certain proteins which has been targeted by the drug in order to show its action, that is enzymes, ion channels, transporters as well as receptors. If you see enzymes, certain enzymes inhibit the function or enhance the functions. That is what they say. Drugs can either increase or decrease the rate of enzymatic action. So enzyme inhibition, when you see, there like here are few examples which has been given. You can go through them. I will share you the PPT. Then ion channels, which can act on a ion channels. So the gates of the receptors are closed or opened because of the ion channels inhibitor or stimulation effect of the drug. So G proteins we commonly find in cardiac system, you can find, as well as taste receptors also you can find, which will help in perception of taste or any other action which we see. Then here especially they act by voltage gradient. Then transporters, a drug can also act on a transporter. Here I already saw a drug can act on an enzyme, ion channels, or transporters or receptors. So if you see the transporters, they can bind to the particular membrane of the transporter, and then it can alter the effect of the drug, alter the effect of the metabolism or the effect of a physiology of a bodily function, physiology of the body, by inhibiting or stimulating the transporter. Then receptors, again receptors which are present on the local surfaces of the cell membrane, where the binding can help in absorption, or binding can avoiding the entry of a particular compound or ion. Here drug receptors, you should know drug receptor action, you can understand with the following terms. You should go through this: agonist, where an agent which activates a receptor. So a drug can act as a agonist by activating a receptor. Inverse agonist means it will reduce the effect of a receptor or act as a reverse, it creates a reverse functionality in the receptors. Antagonist is reducing the activity of a receptor, whereas inverse and agonist is which will reverse the functionality of a receptor. So you should go through these terminologies. You can come across with G protein linked receptor, ion channel linked receptor, transmembrane enzyme linked receptors and all. And you should always know drug potency and efficacy in pharmacokinetics, pharmacodynamics. Drug potency, which refers to the amount of drug needed to produce a certain response. You want a certain specific response, how much effect amount of drug is required, that is considered as drug potency. Then drug efficacy, how much a maximum drug you can give to see the effectiveness of a drug. There is a chart. Then you should know about therapeutic index. This is also very important, where it is dealing with the lethal dose by effective dose. We already saw the effective dose is nothing but a drug potency, as well as lethal dose which can cause harm to the body. This ratio gives us how much a drug can be given to see the therapeutic effect of the drug. So few more points. This you can go through them. I will share the PPT. Yeah. Then comes the drug dosage forms. Like I already told, certain factors which influence pharmacokinetics and dynamics are also understood under general pharmacology. So drug dosage forms, you can know that various forms are available in the market, that it can be a solid form, liquid form, and semi solid form. Like in ayurveda also you have powders, lotions, liquids, you have powders, liquids, and gaseous forms of drug. Similarly here also you have various forms of drug dosage forms, various forms of drug dose. How, what is the main need of this drug dosage form? Like we said in ayurveda, we say that bahukalpam is first prior factor for a drug selection, right? Prashasta beshaja lakshana, when we see, we call it as bahukalpata, means converting into various dosage forms. Why it is needed? Why it is needed is, it helps us in giving accurate dose. If in the form of tablets you are giving, you can fix, or liquids you are giving, you can give, you can tell that you have to take this much ml, or this many tablets, or this much mg, you can fix when you know, when you have a particular dosage form. And sometimes you can protect the drug from damage, like you have seen coated tablets where it prevents the damage while transport, and some tablets when you see they are entry coated which will prevent the gastric juice action. Then masking of the taste, many a times when patient comes to our clinic level, they will say, sir, I cannot take this because your kashayas are very bad tasted, kashaya chanagilla. So in such case, a better taste of drug can help them to improve. Dosage form helps, like kashayam form, if you give in the same in the form of tablet, the patient will be so palatable, odor will be less, and so the person takes it easily. And it also depends on certain tissues where the drug is placed. So the media, certain media is required for each drug to get absorbed. So the route of drug administration, or the media in which the drug comes in contact with, plays a major role. Sustained release medicines as well as controlled release medications can be opted. Ophthalmic drugs can be designed. Then inserting into the body cavities, like in kids when they are suffering with fever, when they are non-cooperative, temperature is not coming, what we do, we give a diclosuppository, right? Similarly you can get various forms, and even you can make it soluble are easily available when the drug is insoluble also, with the form of drug you administer. And it minimizes the discomfort which is created to the person, and gives instant relief also, improves patient compliance, that means it is more friendly for the drug person to take it. Then desired properties of giving a dosage form. When you do a dosage form, it should make the patient very easily to get handled. So it should not be too tough to handle. Stable or stored. It can be stored easily. Then it should avoid, or it should withstand the transport shock which is given. Like when you are transporting the tablets, you know, many a times parcels has been thrown here and there, so it should withstand the shock which is created by the throw and all. Then flexibility in the dosage forms, many a times you can observe when the a tablet which is required in small quantities is not available, people what they do, they break the tablet and take it. So it makes us easy for giving it or administering it. Provide expected therapeutic effect, so whatever the therapeutic effect you are expecting, it should provide it. Then excellent, yes, sir, extent, drug release and onset, intervention and duration of the drug action can be assessed easily. with the help of dosage form or can be attained easily with the help of dosage form. Commercial and sorry economical and elegant can be made. These dosage forms, this is based on, first is based on the physical state where solids, semi-solids, liquid, gaseous and miscellaneous forms comes. Then route of administration, all these if you see they can be again subdivided into topical, oral, and parenteral. Enteral, parenteral, and topical. These three categories you can make. Anything which is given orally, you can take as orally or rectally, you can take as enteral route. Anything else where alternative form of blood transport is there, then you have to take it as parenteral. Whereas local applications are taken as topical form of drug administration. If you see eye tooth as well as drugs used in eye tooth as well as eye skin, they comes under topical. The lotions and all which we apply regularly comes under this topical form of applications. Even based on the usage, internal usage form as well as external usage forms, you can come across it. When we see dosage, solid dosage form, powders, tablets, granules, capsules, sachets, pills, lozenges, suppositories, and all you can come under that. Then liquids you can come across with suspensions and emulsions, which are two common things which you can find with it. Then enemas, then gels, liniments, then mixers, mouthwash, liquids, and all nasal drops. All this comes under route of drug administration. Then our dosage forms also. Then semi-solid dosage form, when we see ointments, cream, paste, gels and all comes under semi-solid. Gases where aerosols, inhalers, sprays comes under this. When you see Ayurvedic dosage forms, you come across with the same thing: solid, semi-solid, and liquids. Where semi-solid solids you come across with powders and tablets, semi-solids avalehas, lepas, and valaharas. Then liquids asava, arishta, kashayas, and tailas. A brief point of it: churnas, which are nothing but fine powders, which can make us easy to carry. What is andal which is again easy to carry and easy to administer. Asavaristas, liquid dosage forms where fermentation happens, so that needs a caution when they administered. When you can call, then avalehas, which we come across with it. Various forms where you are commonly seen with Chavanaprasha and all, where kashayas or swarsas are made. With that, they are boiled and mixed with the sugars or sugar candies, commonly jaggery, honey is added and made and avalehas. This is a brief note about different aspects of general pharmacology. First, we should know about, we will read about a drug. In general pharmacology, you completely deal with the drug as such, where which is nothing but dry drug, dry herb. Drug is nothing but dry herb, which our science is also dealing with it. It deals two components of the drug. One is its pharmacokinetics and dynamics. The second is factors influencing pharmacokinetics and dynamics. All these two are read under our pharmacology. That is very important. So, a brief note, I have completed the presentation on for general pharmacology. Hope it is easy for understanding. Any questions?
So thank you, sir. The session was informative. If any further queries, we will message you the queries asked by the students, and you
Sure.
can reply there, sir.
Thank you.
Thank you, sir. The session was so much informative, and thank you for helping here, and thank you for joining the team Panchajanya, and
I
thank you
tried my
for
level best to concise the
no,
topic and make it easy for exam.
yes, sir. The points were really informative, and I hope if any queries, we will. We will ask you in the message board,
Sure.
and thank you so much, sir.
Thank you.
So we can end the session. Thank you.